Kudos for the introduction. I would like to start now by explaining how cancer develops, and then I can go on to talk about conventional treatments and the difference to our approach. Let's start with some cancer statistics. These are numbers from the World Health Organization, and as you can see, 2012, there will be 14.1 million adults in the world with the diagnosis of cancer, this new diagnosis of cancer. In the same year, 8.2 million people will die because of this disease. It is predicted that there will be 23.6 million new cancer cases worldwide each year by 2030. Let's get an overview about our body and the cell. Why will I start with the cell? This will help you later to understand why cancer is so difficult to treat and why we need a different approach. Each organ, the cell is a building unit of the human body. And different types of cells create different types of organs. Each organ has its own function according to its cell. As an example, liver cells are mainly specialized for producing lots of enzymes, while red blood cells for carrying oxygen and nutrition to the body. Our body is in a constant change, renewing itself through cell division. The damaged and old cells are replaced. Some cell types are dividing more often than others. For example, bone marrow cells, which are responsible for producing our immune cells. GI tract cells, responsible to build up the digestive system. And hair follicles, responsible for hair growing. I'm giving you these examples so that you can understand later why chemotherapies or conventional therapies have severe side effects on the body. One characteristic of cells is that almost all of them have a cell core which contains the DNA. The DNA holds the genetic information of the cell and controls all its functions. This genetic information controls the production of enzymes and other molecules of the cell. It determines the structure and the cell components like mitochondria and its form. In summary, DNA defines the function and the type of each cell. In order for each organ to work properly and be in full function, its cells need to divide to renew and replace the old ones. As each cell divides into two new cells, its DNA divides as well in order to make new copies of the DNA. And every newly formed cell contains the same genetic information of the original cell, which you can see on this slide. So you have a cell with a DNA, and at the end, after the division process, you have two cells or more with the same DNA, the same information as the mother cell. This is very important to understand. I will now explain you some mechanisms of how our body is protecting ourselves from damaged DNA. The topic is about apoptosis. Cells of a human body may get damaged by many causes, as radiation, smoking, alcohol, and viral infections. Some of these damages on the cell and on the DNA are reversible and can be repaired by special mechanisms of the cell, so-called DNA repair mechanisms. But if there is a critical damage on an important area of the DNA, we call them mutations, then these damaged cells will activate the process of self-destruction through a programmed killing process called apoptosis. The process of apoptosis is elemental and is protecting our body from critically damaged cells. This is one method how our bodies on a cellular level protects us from getting cancer. You can see on the slide that when there is a healthy cell and when there is any damage to the cell that the cell is trying to repair itself. If the cell is not able to do this, or if there are any additional damages, then it starts the self-killing process. This means this cell is dead. It cannot divide anymore, and it cannot grow, and it cannot harm the body. It's dead. It will be replaced by a healthy cell. So what happens if this process is not working, if this process is not working properly? When it fails, we said that whenever there's a critical damage, the cell is activating the process of apoptosis and is killing itself. So how is it that some cells are not being killed, that they survive? This occurs when the DNA damages are by coincidence in the same area which is responsible for activating and controlling the apoptosis. As a consequence, the cell with a damaged DNA will not be able to destroy itself and will keep on dividing. All daughter cells will contain the same damaged DNA. These cells have lost the ability to apoptosis and will keep on dividing without control, and this is the start of cancer. As you see in the first picture with a normal cell division, whenever you have an injured cell, you have apoptosis, and the cell will kill himself. If you don't have apoptosis because the damage is in a special area of the DNA, then these cells will all lose its ability to kill itself. They will divide, and this is the first step of a cancer disease. So in summary, we can say there are two main mechanisms to protect us from cancer. One is apoptosis, as I explained. It's a self-programmed process. Whenever we have any critical damage to the cell or its DNA. The second mechanism is our immune system. Many people know that our immune system is protecting us from bacteria, from viruses, from parasites, but one of its main functions is also to detect and destroy newly formed cancer cells. So whenever apoptosis is not working, we have still a second mechanism, our immune cells, which are able to detect and to kill and destroy these cells. Among the immune system, I want to speak about the group of lymphocytes, which are very special immune cells. They are produced in the bone marrow, and we can differentiate them into two. I was talking about the immune system, and that the immune system is, beside the apoptosis, a second important system which protects us from cancer. Whenever apoptosis fails to work, then our immune systems are able to recognize cancerous cells and to kill them. We have two main, the lymphocytes are special immune cells, and I would like to talk about two types of them, the B and T lymphocytes. The B lymphocytes are mainly trained in the bone marrow, and the T lymphocytes are mainly trained in the thymus gland. On this picture on slide 10, you can see how T lymphocytes are attacking a cancer cell, which is the red cell. Of course, this is in laboratory, but you can see that the tentacles of the cytotoxic T cell is going to the cancer cell, and as a result of this, of some biochemical reactions, this will lead to the death of the cancer cell. So let's talk about the development of cancer. Cancer has always many reasons, and it has never one reason alone. It's always a combination of many independent factors, and I would like to list some of these factors. One factor is, for example, the DNA damage. This is what I explained in the beginning. If you have critical DNA damages, mutations, especially in the area which controls apoptosis, then this can lead to cancer. Age is one factor. The older we get, the weaker the immune system becomes. Chronic stress is one factor, because chronic stress is leading to the production of hormones like cortisol, which increases the risk for cancer by suppressing the immune system. Bad diet, like junk food, or lifestyle factors like smoking, sleep deprivation, stress and alcohol. We all know this. So the question is, why is the immune system not recognizing such damaged cells? What is the reason for this? Because everyone has a immune system, and even if it's weak, it's working. We know this. I mean, there are some factors which is typical for cancer cells and which helps them, or which makes it difficult for our immune cells to detect them. One factor is, for example, that the tumor cell is developing from our own cells. It's not like a bacteria or virus which is coming from outside to our body. Tumor cells are developed from our own cells, and they have a lot of similarity with healthy cells. As a result, the immune system has difficulties to classify them as foreign or as dangerous. Another factor is that the changes of normal cells to cancerous cells is a very slow process, and it can take a very long time. We are talking here about 10 to 15 years. So the immune cells become accustomed to the mutated cells. They don't recognize, because there's such a slow change in their structure, the immune cells has difficulties to recognize them. Of course, there are also some other factors how tumor cells are actively protecting themselves from our immune system. They can produce a certain protein layer which protects them from being recognized by our immune cells. We will talk later about these protein layers. So if you see the next slide, then this is an example for lung cancer about the common risk factors. You have so many factors which has to come together until you get cancer. To understand why current cancer treatments are not working in most cases, we have to understand the different characteristics of a tumor. A healthy tissue, as you can see on the left side, is well organized. These cells are very specialized, and they grow in a uniform pattern. Each of these cells from one organ, they have the same type of DNA, the same cell form, and the same function. While cancer cells are totally different, as you can see on the right side. Because of many different DNA changes, cancer cells show a great variety. In the same tumor mass, you will find many different cells with different DNA and different characteristics. You will find cells which can be killed by a certain drug, besides cells which are strong enough to survive. Another characteristic of a tumor is that the blood flow is totally different within the same tumor. Cancer cells start as a cell mass, and when they reach a certain size, they have to produce new blood vessels. Very often they grow faster than they can build new blood vessels. Therefore, you find areas within the same tumor which are well vascularized, and areas which have a bad blood supply. This has also an effect for cancer treatments. The next slide is showing, for example, newly grown blood vessels. As you can see, that not all cancer cells, as you can see that some parts of this cancer have a good blood supply, while others have only small vessels. So what has this for a consequence for chemotherapies? The effectiveness of a chemotherapeutic drug depends on how well it can reach the cancer cells. If you have a big tumor mass area with low blood supply, the drug will not even reach the area of the cancer cells, and they will survive and continue to invade normal tissue. This means that the chemotherapeutic drug will never reach a critical concentration in such areas which have a very bad blood supply. Together with, of course, when you have different blood supply within one tumor, you also have different oxygenation status. Oxygen is being transported by our red blood cells, which need blood vessels to reach the cells. Low, poorly oxygenated cancer cells are very resistant to radiotherapy and also to some chemotherapies. That's why when you use radiotherapy or when you use chemotherapy, you will always have cells which survive. Another characteristic of cancer cells is that they have a different metabolism. Malignant cells consume glucose as energy, but unlike the healthy cells, they are metabolizing it without oxygen. This process is called fermentation, and they do this even if sufficient oxygen is available. The energy output of this fermentation process is around 15 times lower than by normal oxidation. But to compensate this disadvantage, they have a 20 to 30-fold higher glucose uptake than normal cells. I'm giving you all these examples of the characteristic of tumor cells. Later you will understand why these factors are very important in the treatment of cancer. Another very bad characteristic of cancer is that they produce metastasis. Metastasis is the spread of a cancer from one organ to or part to another not directly connected part. Cancer cells can use the lymphatic system or the blood vessels to other regions of the body where they build secondary tumors. Here you see the PET picture or PET CT of a patient with breast cancer. In the middle you see the bone marrow and you see this yellow spots. These are all metastases. These are all cancer cells. So you can say that this tumor has metastasized to the skeleton of the patient, mainly to the spine. So let's see how the situation of a cancer patient is before he starts the treatment. I see that this slide is not as on my computer, it's different online, but I will explain the slide so it will be easier to understand. What is the situation before? The situation is that the patient has a detectable growing cancer. Detectable means, in many cases, the cancer is bigger than 1 millimeter, which contains 10 million cells minimum. Smaller than a few millimeter is not detectable by modern imaging techniques. The immune system of a patient before a treatment is weak. It must be weak. Otherwise, the immune system would recognize these cells as cancer and will kill them. So we can summarize that all cancer patients have a weak immune system. The organ function can be normal, can be normal or can be bad. It depends on where the cancer is growing. If it harms important organs, if it has metastasized in, for example, liver or kidney or not. Psychology, or let's say mental health, is down. The patient is afraid of death, has maybe pain, is suffering from the disease. The diet is a very bad diet. Usually, we all have an unhealthy diet. The modern human's diet is characterized by high amount of carbohydrates, refined sugar, processed meat, and low amount of vegetables. The lifestyle, we have a bad lifestyle. We live and work in stressful environments. We sleep too less, smoke or drink too much alcohol. And the life quality of such a patient is also very bad. So this is the summary before the treatment, and I will make this summary also for a patient after a conventional treatment and after a complementary treatment. Let's come to conventional treatments. There are three main conventional treatments, as we all know. First, surgery, chemotherapy, and radiotherapy. Surgery. Surgically removing the cancer is the most effective way to reduce huge tumor masses, and in most cases surgery has acceptable side effects. But it's fair to say that the surgeon can only remove what he can see with his eyes and what imaging has showed him before. He cannot detect small lesions, and he can also not detect possible existing circulating tumor cells. Means The surgeon is, for example, for a breast cancer, the surgeon can only cut out the main cancer, which he can see with his eyes during the surgery. But as I told you in the beginning, there are cancers smaller than a few millimeter, and they also have already 10 million cancer cells. So surgery is not effective in cutting out metastasis, small micrometastasis, which the eye of the surgeon cannot see. And also we all develop circulating tumor cells. These are these are isolated cells within our bloodstream. Surgery is not an effective tool to treat these cells. That's why surgery is mostly combined with chemotherapy or radiotherapy. What is chemotherapy? Chemotherapy is a treatment of cancer with chemical substances. It's able to kill mainly fast-dividing cells, such as cancer cells. Unfortunately, as I mentioned in the beginning, GI tract cells and bone marrow cells are also dividing very fast. So whenever you applicate chemotherapy, you are killing a lot of cancer cells, but you are also killing all quick dividing cells of our body, which are GI tract cells, which are bone marrow cells, and which are, for example, hair follicles. When we check the bone marrow and see what is produced in the bone marrow, then we will see that red blood cells and white blood cells, which are our immune cells, and platelets, which are responsible for blood clotting, are all produced in bone marrow. That's why after every surgery, after every chemotherapy, you have severe side effects on bone marrow and also on our immune system. Limitations of the chemotherapy is, of course, that there are some cancer cells, I told you, they are very different in their strengths, that some cancer cells are resistant to chemotherapy. And I also explained to you that the blood flow within the cancer is different. It's in some areas very good, some areas very bad. So the chemotherapeutic drug will not reach such areas. And a very big limitation is that chemotherapies have also huge side effects on other organs like liver, heart, kidney, or brain. The third conventional treatment is radiotherapy. Radiotherapy is using ionizing radiation to kill cancer cells. Similar to surgery, it can kill a localized tumor without killing circulating tumor cells or micrometastasis in other areas. Radiotherapy is damaging the DNA and can also cause cancer. It has severe side effects on healthy tissue and on the bone marrow too, and thus it has a devastating effect on our immune system. So before we proceed, I would like to give you an overview about resistancy, what happens with the cancer after chemotherapy. Here you see as an example a tumor with different cancer cells, and as an example I marked 2 cancer cells as resistant to this chemo drug. So when you apply chemotherapy on these cells, you will see in the next step that you will kill all blue cells, which are the weak cells or not resistant cells, and what remains are the resistant cells, cancer cells of course. And in the next process, such resistant cancer cells will divide and multiply and will grow. So the result is that each time you, after each session of chemotherapy, you will have more and more resistant cells. And this is the reason why chemotherapy is not working after a few sessions anymore, because you have developed too many resistant cancer cells. Let's talk about the outcome of chemotherapies. It's difficult to define a general outcome for all treatments together, but there's one interesting study from 2004. Morgan and his team examined the contribution of chemotherapy to 5-year survival in adult cancer malignancies. They undertook a literature search for clinical trials, reporting a 5-year survival benefit solely to cytotoxic chemotherapy. The total number of newly diagnosed cancer patients for 22 major adult malignancies was determined from cancer registry data in Australia and from the surveillance, epidemiology and end results data in the USA for 1998. The conclusion is the overall contribution of curative and adjuvant cytotoxic chemotherapy to 5-year survival in adults was estimated to be 2.3% in Australia and 2.1% in the USA. Means that by giving chemotherapy, only 2.3% of the patients in Australia and 2.1% of the patients in USA will live more than 5 years. This is the contribution of chemotherapy. Of course, this study was criticized by many oncologists, especially in Australia, and some of the critics were right, and they came to the conclusion that the 5-year survival rate should be around 6%. But this, of course, 6% is higher than 2, but it's also not a very big contribution. So let's have an overview now about the patient. Let's give an overview about the patient after a conventional therapy. I told you before, conventional treatment immune system is low, organ function can be normal or low, mental health is low, the diet is very bad, lifestyle is very bad, life quality can be normal or low. But after a conventional treatment, you have a worse immune system than before the treatment. Why? Because you treated the patient with chemotherapy and with radiotherapy, which is harming the immune system. So we can summarize that the immune system of a patient after a conventional treatment is always worse. The same you have with organ function. The organ function, which was normal or bad, depends on tumor growth before the treatment, is now worse because of the side effect of conventional treatments. Mental health, I would say, can be also worse or in the same bad situation like before because of the side effects, because of lowering the life quality of the patient. The diet didn't change because there is no cancer diet program in conventional medicine. Lifestyle didn't change because you don't have lifestyle programs. You are not educating the patient how to live, what to avoid. And the life quality is also worse if you compare it with the beginning, because additional to the cancer, the patient has now the side effects of cancer treatments. And I know a lot of cancer patients who say that they would like they prefer to die instead of having a chemo again. So the summary about all these points about immune system, about organ function, about the psychology, about diet, is we can say that after conventional treatment it is worse. There is no improvement in that. So let's come to an alternative or an integrative approach, which we are doing in our Verita Life clinics. But I would like to start with the word integrative or alternative. There is no generally accepted definition for the word integrative oncology. But the most common is that it's a combination of conventional oncology with complementary and alternative therapies. Personally, I oppose to the term alternative medicine. I have studied conventional medicine and I'm working in the field of cancer since more than 13 years, and I don't consider our therapies as part of alternative medicine. But I admit that they are not common or well known in conventional medicine. I witnessed in many years of work that conventional oncology is not covering all aspects of the cancer patients and all factors of cancer disease. It has its gaps when it comes to immune and organ support, as I showed you, mental health and general condition, lifestyle and diet, and these are facts. Almost every cancer patient can confirm this. Our goal is not to demonize conventional medicine or doctors, but to find a way to go out of this dogmatic approach that surgery, chemotherapy, and radiotherapy are the only ways to treat cancer. We all know that the outcome for cancer patients are still very bad, and therefore we must be open for any new evidence-based approach. I strongly believe that conventional doctors care about their patients in the same way as we do, and like many of them, I am also against any treatments which are scientifically harming or useless for the patient. Therefore, I consider our treatments as complementary cancer treatments, treatments which we can add additionally to conventional treatments, sometimes to boost the effect of conventional treatments or to reduce their side effects, but sometimes also to treat the patient with good tolerable treatments, especially when they are too weak for conventional treatments. Because the reality is that whenever conventional treatments failed to help the patient, the patient is being sent home with the message to die. And here is the part where where complementary medicine can help. Our treatments are mild and good tolerable and suitable for almost all cancer patients. However, it must also be said that not every chemotherapy or radiotherapy is necessary or helpful for our patients. Let's come to the philosophy and the treatments of Verita Life. We can summarize all our treatments in 7 main groups. We have a detox program, and I want to give a few examples for every program. I cannot go too much in detail, otherwise I would have to speak for many hours, and this will be maybe too much information, but I will give always a few examples from every field. As an example for our detox program is manual lymphatic drainage, which intend to encourage the natural drainage of the lymph, which carries waste products away from the tissues back towards the heart. Or we have organ support programs. We check important organ functions and treat with natural and conventional substances to relieve and support the organ. This helps to recover from side effects of chemotherapy and radiotherapy. We have special programs for liver, for kidney, for heart, for bone marrow and nerves. So what we can see is whenever the patient is coming from a conventional treatment with very bad liver values, we are treating the patient for a few weeks with very certain substances which relieves the liver function and enhance its function. You can monitor that the liver values become normal again. One big okay, let me talk now about the small points, and then I will talk about some cancer treatments and immune support. We are encouraging the patient to make exercise. This exercise will help that the patient is building up muscle, that the oxygenation status of the patient becomes better and the life quality improves. We have a 6 weeks educational program where the patient gets information about how to live healthy, what to avoid, about sleep, about meditation, about what to eat and what to avoid. And regarding the diet, we have a full ketogenic kitchen. We have an own kitchen where the patient see what we are doing and where we train the patient how to prepare meals. And within this topic, I would like to talk about, especially about ketogenic diet. Ketogenic diet, usually our diet contains 60% carbohydrates, which is negative for a cancer patient. It promotes cancer growth. The ketogenic diets reduce carbohydrate intake from 60 to 10% and increase the amount of fat. Because of the absence of glucose in our diet, the body is using the fat to produce ketone bodies as energy source instead of glucose. We know that all body cells, with the exception of red blood cells and cancer cells, are able to utilize ketone bodies. This means that we take away from the cancer cells the energy source, while the rest of the body can keep its normal function by using ketone bodies. There's one big treatment section is the immune support, and I would like to give here 3 examples. We use GC-MAF. This is it's a macrophage activator to boost the immune system. Let me speak shortly about macrophages. Macrophages are large immune cells that are able to recognize and digest cancer cells. They are also responsible to stimulate other immune cells. Macrophages can be activated by our GC-MAF, which we call Golaic GC-MAF. It's a new form of GC-MAF. Tumor cells are producing a special enzyme called negalase to prevent macrophages from doing their work. Means that they are suppressing our immune system. As a result, macrophages can't be activated and the immune system is suppressed. We are treating our patients with Golaic GC-MAF to reactivate the immune cells and to boost the immune system. Many studies prove that GC-MAF is not only an immune activator but can also be used in cancer treatments. The next slide is showing you macrophages attacking a cancer cell. I don't know if you can see my arrow here, but the one with the spikes is the cancer cell, and the round cells on it are the macrophages. Okay. Besides GC-MAF, we are using whole body hypothermia to boost the immune system. Whole body hypothermia is stimulating artificial fever. Fever, as we know, is associated with a variety of immunological reactions. Therapeutically, whole body hypothermia is activating the immune system by telling the body that it has fever, and also it's able to enhance many chemotherapy therapies. The third strong therapy within a treatment within the immune support are thymic injections. Thymic therapy involves a series of thymic gland extract injections which activate and balance the body's immune system. The thymus gland is located just behind the sternum, on the top of the heart. This gland is the center of our immune system. The function of the thymus is to produce and educate T lymphocytes, which I mentioned before. These cells are critical to our immune system. The thymus changes its size and function during our life cycle. It's largest and most active in newborns, infants, and in the near prior to adolescence. By the early teens, the thymus begins to shrink and thymus tissue is replaced by fatty tissue. Nevertheless, a small amount of T lymphocyte production and education continues throughout adult life. Due to the reduction of size of the thymus gland during our life cycle, the thymus-related immune response reduces as we age. When we reach 50, only about 15% of our thymus is still functioning. By giving thymus peptide extract, the number of white blood cells can be increased and their functionality improved or restored. Let's come to cancer treatments. As you see, we have a lot of cancer treatments here, like low-dose chemotherapy. I will talk about this. Local hypothermia, artemisinin, sodium selenite, co-drugs, high-dose vitamin C, enzyme therapies, and herbal treatments. Due to limitation in time, I will talk today about low-dose chemotherapy, about IPT, about local hypothermia, about high-dose vitamin C, and artesunate, which is artemisinin. Low-dose chemotherapy. I mean, I told you before that that conventional treatments are using chemotherapy with very bad effects on our bone marrows, so on our immune system. So what we are doing is we are using chemotherapy in very low dose, and but on a more frequent schedule to reduce and eliminate the toxic side effect of the drug. It maintains the effectiveness of the drug by potentiating its anti-cancer activity with the use of insulin. The mechanisms why insulin is supporting low-dose chemotherapy is still not known. Some scientists say that by giving insulin, the concentration of low-dose chemotherapy is higher within the cancer cell. And there are many theories why it's working together in a synergistic way, but so far we don't have an exact knowledge on how it works. But the results shows that that insulin is enhancing the effect of low-dose chemotherapy, and this is preventing the patient from having severe side effects. So our patients, they don't suffer from nausea, they don't suffer from a chronically depressed bone marrow. Their life quality is still stable. So what we are doing is we are giving low-dose chemotherapy 2 times a week, and of course for some weeks, and we see that even cancer patients who were treated before with conventional chemotherapy shows a response to the low-dose chemotherapy. The second big cancer treatment in Verita Life Clinics is local hypothermia, which is very strong in or very often used in Germany and Japan. With local hypothermia, we are able to increase the temperature within the tumor very specifically. You can see on the next page on the slide that there's a picture from a local hypothermia machine, and you can see a patient which is under a probe. And I would like to explain you this. With the help of an applicator which we place on the skin, we can send energetic waves into the local tumor mass and damage it. In distinction to conventional radiotherapy used in X-ray radiation, a local hypothermia treatment is not radioactive and is well tolerated. This treatment can be given without causing any harm to the patient. This method can be used on most patients, regardless of tumor stage and general condition. And the good thing is that the tumor cannot develop resistances against this treatment, because it's a physical treatment. Means after a certain temperature, which we can reach inside the tumor, all cancer cells will die. Cancer cells are consisting of proteins, and after a certain degree, after 42.5 degrees Celsius, we have protein denaturation. Means that the cell is that the proteins are being denaturated by heat. So you can kill the cancer cell regardless how resistant it was before against chemotherapy or radiotherapy. So the question is why healthy cells are not dying. And the answer for this is that healthy cells have a good blood flow system, blood supply system, and they can transport the heat out of the area very quickly. While cancer cells have a very chaotic blood vessel system, and they are not able to transport the heat away, they cannot adjust their blood vessels to the heat, and therefore we can reach a critical temperature within the tumor much faster than in healthy tissue. So you can apply this local hypothermia to, for example, to the liver, where you have a liver tumor, liver cancer, and you will monitor that liver cancer cells are dying while the healthy liver cells are surviving. We are also treating the patients with high-dose vitamin C intravenously. And what is the effect behind it? High-dose vitamin C promote the formation of hydrogen peroxide, and cancer cells are particularly susceptible to damage by such compounds. What we see, the good thing is, best of all, that unlike virtually all conventional chemotherapeutic drugs can destroy cancer cells, but they are not selective, while vitamin C is very selectively toxic. No matter how high the concentration of vitamin C is, it will not harm healthy cells. As a third example for our cancer treatments, I would like to speak about artesunate or artesunate. Artesunate was initially developed as an anti-malaria drug, but many studies have demonstrated that it's also effective against various cancer. It's derived from a herbal plant and has low side effects. And it's very interesting that artesunate induces apoptosis in cancer cells. So it is the same mechanism which I explained to you before, which is missing in cancer cells. So by giving this drug, which has very low side effects, to be honest, I'm talking about very low side effects, but I never witnessed any side effect in my life with artemisinin. You can give it in very high concentrations, and it's selectively killing cancer cells. So let's make a summary about the patient situation after a complementary treatment. We have again this table with the three with our factors. So let's look at the immune system. The immune system after complementary treatment is better than before, in comparison to a conventional treatment where you destroy the immune system with chemotherapy or radiotherapy. The organ function is definitely better because we monitor each organ function. We are checking the function and we are increasing it with special certain substances. Mental health is improved after a complementary treatment. We have our mind-body treatments. We are educating the patient. We are informing him about his disease. We are urging him to take actively part in the healing process. These are all things which improve the mental situation, the mental health situation of the patient. The diet is a completely different diet. With other words, we can say that we trained the patient to follow an anti-cancer diet. The lifestyle is automatically changing by giving the patient information how to prevent from cancer, and of course, because the side effects, because our treatments have low side effects, the life quality is better than before. It's automatically better when you have better organ function, when you have better immune system, and when you have cancer treatments which have very low side effects. This is the end of my lecture. I would like to thank you for your time. Let me hand back to Bruce, and if you have any questions, we will make sure that they get to me, and I will be happy to answer them. Have a nice day. Thank you very much.
Professor Gunas, I would just like to say that is the most interesting and informative lecture about complementary alternatives that I have ever heard. And folks, I think we were very, very fortunate to hear what we have just heard. I mean, you just do not hear this sort of information from other sort of medical practitioners, do you? I mean, this was something that you would, in a lifetime, you would never be able to sit down and hear this sort of information. And I would like to thank you so much, Professor, because this is the beginning of a long coexistence between the foundation and what you're doing up there, because we have firmly been promoting in our way many of the things that you've been talking about tonight, but you were able to explain them in more detail on why we do them. And you can see, folks, why, if you've got cancer patients, you can see the more radiotherapy and the more chemotherapy they have, the more resistant they become. Their cells become to those modalities, and therefore they've got no hope of surviving. And so that's why we as members of the foundation have got to get wound up about this, and we've got to say to people, no, get on a plane. It's 9 hours. and a 2-hour or maybe a 3-hour time change, and you're in Bangkok for a month. You'll be looked after at a 5-star hotel. It'll cost you money. But I mean, it's just the most sensible way of restoring your wellness that I have ever heard. And I can say that all of the prevention plan that we have been supporting now for 3 or 4 years, our pre and post stem cell treatments, you can hear, because they're all about cells. And tonight was all about cells. What's going on with the cellular structure in your body? What's going on with your immune system? And why it works and why it isn't working in some other cases. That's what this was all about. And you can see why it's important to go into ketosis. I mean, it seems, because once you go into ketosis, the cancer cells can't live on the sugar, the energy that's produced by the ketones. When I first heard about a protein-sparing modified fast, and they talked about the ketones, I thought it was a new rock group. But, you know, they are absolutely fantastic and all you do is deny the body sugar and you'll go into ketosis. It's an extension of the 5-2 diet. 2 days of being on 600 calories and the rest you eat about 5,000. But in a ketogenic diet, you stay on this low calories all the way through, and you take proteins to try and supplement, you know, instead of the weight loss coming from your muscles, it's coming from your fat, and you live off your fat. Okay, and that creates energy which the cancer cells can't use. Makes fantastic sense, doesn't it? I mean, we've got to get the word out about this, and you can see why. Previously, before Professor started talking, I was talking about hyperbaric chamber. What does hyperbaric do? It forces oxygen at pressure into the cells, and cancer cells don't like oxygen. They're anaerobic. So you can see all of these things that we're trying to promote, our prevention plan, our profiler, our environmental profiler designed in Germany. You pluck a hair from the nape of the neck, and you take the hair follicle, and it can scan the bioresonance in that hair follicle and send you back a report, the practitioner, in 15 minutes from a supercomputer in Germany. And it's giving you all of the environmental influences that are impacting on your DNA. And you heard Professor Gunas say that we can change the expression. We can't change our DNA. You're born with that from the day you die, born till the day you die. But you can change the expression of your DNA. I mean, it's exciting. All of these things we've been talking about are suddenly starting to dovetail together. Exciting stuff, right? We are definitely on the right track. You know now what you've got to do to live a long, healthy life. You know what you've got to do to tell other people what to do. If they don't listen, too bad, right? But the point is, we are hearing information that is unique, it's powerful, it's truthful, and it's something that we have to get out there. So again, Professor, I'd like to thank you so much. You'll be very welcome to come back and talk to us at any stage. We would be delighted to have you. So, folks, I think that's pretty well all tonight. We've been going quite a while. We've been going about an hour, 10 minutes. I can play a few videos if you would like, but I'd like to thank you all for being online. You got rewarded for your diligence tonight, for giving up your time. You got rewarded tonight. You heard something that was very, very unique, and something that'll open your minds and your friends and family's minds on how they've got to live the life. We're on the right track, I promise you. And you combine with what Professor Gunas is saying and what we're talking about, stem cell transplants, our pre and post treatments, our prevention plan, it's illuminating. It's exciting to see how well we are set up for all of you to live a long, healthy life and to control these situations. So now you know why we send cancer patients to Shannon, who in turn, works with Professor Gunas, and they do what they do. It's absolutely fantastic. So thanks for being online. I'd like to thank Professor Gunas again, and Guri, especially Guri, for her help in helping to set up all of this. And I know Shannon Nielsen is online. Shannon is in Sydney at the moment. He's just been at the University of New South Wales completing his Masters, which is all exciting stuff. So, folks, thank you very much. I'll just play a couple of videos now, and that'll be the end of it tonight. And we've made a recording of tonight, so if any of you would like a copy, just let us know. Also, if you want to talk to Professor Gunas, send us your email and your question, and we will send it over there too. All right, thank you very much.